Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about foot drop, or something that's sometimes called drop foot. So if you were to take the model of the foot here, you've got tendons that actually, their job is to cause lifting of the toes when you're walking. Drop foot would be that you have weakness of those, and so you have a tendency that when you lift your foot, the tendons don't react like they're supposed to, and you end up tripping over your toes or having issues that way. Drop foot is commonly a problem of nerve, where it's a nerve injury of some sort, or a nerve paralysis or muscle paralysis in that area where it doesn't function. So instead of walking where you land on your heel and you roll to the toes, then as you lift your foot, the foot comes back up so you don't catch your toes. It has a tendency to stay dropped. There have been multiple reasons why that happened. I've seen it for individuals. I had a firefighter once that actually had a poisoning during one of the fires, basically from the smoke, and because of that poisoning he had damage to the particular nerves, the toxic damage to those nerves, and they wouldn't function like they're supposed to, so they wouldn't lift. You could get polio or some of those other diseases that could actually cause that. You can actually have a stroke that will cause damage to those nerves. There is a position, there's a nerve that sits right below the knee on the outside of the leg that you can actually get compression on it and get a drop foot that actually will, due to pressure on the perineal nerves. The whole point is the nerves are not causing the muscles to do what they're supposed to during the gait pattern. This could be temporary, or this could be permanent, and it could be long-term. The idea is you need to do something to help that foot function like it's supposed to. So the most common is certain types of bracing. There are braces that can actually stimulate the muscles, where they actually send electrical current and they cause the muscles to contract, which will pull the muscles up. If there's damage to the muscles or paralysis or atrophy of those muscles, that's not going to work. So a lot of times you'll just have a brace that actually does an artificial lifting. So when you lift the foot, it has a spring that pulls it up, or it maintains it, doesn't let it push down. So whatever the case is, there's bracing and there's treatments that way that can usually be done. That's the most common treatment we find for drop foot and helping individuals function the way they should. This is Dr. Brandt Gibson. This is your Podiatry Tips Day 142, foot drop or drop foot.